So I wanted to talk a bit more about this very common issue that I hear about, which is people observing feelings of tightness or tension in their hamstrings, whether that's in one side or in both sides. Now, before we look to answer the question of what to do about that, we have to first ask and answer the question why it occurred. So why does a muscle feel tight in the first place? And the answer to that question is almost always found in understanding the functional anatomy of that muscle. So if we look at the functional anatomy of the hamstrings, we have to first understand that they're what we call a biarticular muscle, which just means it crosses two joints. So the hamstring crosses both the hip joint and also the knee joint. Now, secondly, that hamstrings have a role as what we call an anti-gravity muscle, which means it holds us up. So a hamstring has a downward pull, a downward vertical pull on the back of the pelvis, which helps to orient the pelvis and keep it in this upright or neutral position and stop it tipping forwards, which would cause pressure and compression in this lumbar spine area here. Now, if we do lose position of the pelvis and a pelvis does tip forwards, now these two attachment sites of the hamstring have not changed, but we've just moved one end further away from the other end. So if we tip a pelvis forwards, we've actually put that hamstring in a lengthened position. So it's now actually longer, but it will feel tighter because it's being pulled. Now, when a hamstring feels tight, our solution is quite often to try to stretch it, to try to pull on it, to try and either make it longer or make it more accepting of being in that lengthened state. Now, if we do that to a hamstring that is tight because of position, then what we're doing is we're actually making that position worse. If we make this hamstring more accepting of being in a lengthened state, then this pelvis is allowed to tilt even further forwards, which is putting even more tension on the hamstring, so it will feel even tighter, but it's also causing more compression to occur in this lower back. So this is a particular relevance to those people who feel tight hamstrings and also feel discomfort, pain, pressure in their lower back. If your solution is to try to stretch it, to try to make it longer, you may actually be making the problem worse. Whereas the solution to a positional problem is to address the position. So if we address the position of the pelvis, we take the pressure off that hamstring, we allow it to do its job. We also take the pressure off this lumbar spine further up here, but that is caused by strengthening the hamstring. So actually trying to make it shorter, not longer, to pull the pelvis back into position, which then takes the pressure off. So by strengthening the hamstring, we can make it feel less tight. So if we assess and address position, we can have an understanding of what caused the problem, so we have more of a chance of actually making it better.